Let's be real. Getting a handle on controlled substances is a make or break part of your PTCB exam. So in this guide, we're going to master the federal requirements for prescriptions and DEA schedules so you can walk into that test feeling totally confident. And listen, this right here, this is a perfect example of a classic exam trap. It is a hard and fast rule, and getting little details like this right is absolutely non-negotiable for a pharmacy tech. Okay, let's dive right in. We're going to break down the DEA schedules, what makes a prescription totally legit, and those super tricky rules for refills and transfers. By the time we're done, you'll be ready for pretty much any question the PTCB can throw at you on this stuff. So here's our game plan. We'll start by decoding the DEA schedules. Then we'll get into valid prescriptions, refill rules, record keeping, and we'll finish up by looking at some of the most common exam traps. First up, let's crack the code on DEA schedules. Seriously, everything about controlled substance law starts right here. Understanding these 5 categories is, without a doubt, the essential first step. So the DEA basically classifies drugs based on 2 key things: their potential for abuse and whether they have an accepted medical use. You can see right away Schedule 1 drugs like heroin have the highest abuse potential and 0 accepted medical use. Then, as you go down the list to Schedule 5, that abuse potential really drops off. Now, your exam is going to focus heavily on Schedules 2 through 4, so let's really lock in those examples. To help make this stick, let's use a quick memory aid, especially for this class, since it's the most restrictive one you'll handle. For C2, just think severe but prescribed. These drugs, like oxycodone and fentanyl, have a high potential for severe dependence, but they are prescribed legally. Now for C3, try this one: moderate abuse, some refills. It's a great way to connect drugs like Tylenol with codeine to their moderate abuse potential, and it kind of hints that the rules are a little less strict than for C2s. And for CIV, a fantastic way to remember it is low abuse benzos. This immediately ties that low abuse potential to a super common class of drugs you're going to see all the time, like Diazepam and lorazepam. Okay, now that we've got the schedules down, let's look at the anatomy of a valid prescription. And trust me, the DEA is incredibly specific about what has to be on there. You guys, there is absolutely no room for error here. Every single one of these things has to be on that prescription: patient info, prescriber info, and that includes their DEA number, all the drug details, and the date it was issued. If even one of those is missing, that prescription is legally no good. All right, lean in for this next part, because this is where so many people lose points on the exam. Let's master the refill and transfer rules so you don't fall into these really common PTCB traps. This chart just lays it all out perfectly. Just look at the column for Schedule 2 drugs. The rule couldn't be simpler: 0 refills and 0 transfers, ever. Now, look at that next to C3s and C4s. See? Here, you get a little bit of flexibility. You can have a limited number of refills and a one-time transfer. This contrasts, oh yeah, it's a huge favorite for test questions. For C3s and C4s, let's burn this first number into your memory: 5. This is such a critical exam number. It's the absolute max number of refills allowed on one of these prescriptions. But those 5 refills aren't good forever. They kind of have an expiration date of 6 months. So a patient can get up to 5 refills, but it has to happen within 6 months from the day that prescription was first written. And what if a patient wants to move their C3 or C4 prescription to another pharmacy? Well, they can do that exactly once. Just one single transfer is allowed for the entire life of that prescription. Handling the prescription correctly is only half the battle. Filing it properly is just as important. So let's cover the specific rules for security and record keeping so you can stay compliant. The DEA requires a really clear system. Step 1, all your Schedule 2 prescriptions have to be filed completely by themselves. Step 2, you can file Schedules 3, 4, and 5 together with your non-controlled scripts, but you have to make them easy to find, usually with a big red C stamped right on them. And Step 3, all of these records have to be kept for at least 2 years. Okay, we've gone over the rules. Now for the fun part. Let's try to get inside the heads of the test makers and look at some of these high-yield exam traps that are designed to catch you off guard. Okay, here's a classic scenario for you. A patient comes in, they want to refill their Oxycodone prescription. You see it was only a partial fill last month, so can you give them the rest? What do you do? The answer is a hard no. It doesn't matter that it was a partial fill. A C2 prescription can never, ever, ever be refilled. This is an absolute rule you have to remember. The patient needs a brand new prescription from their doctor, period. All right, how about another tricky one? We know that C2s need a written or a secure electronic prescription, right? But what about a real emergency? Can a doctor call in a prescription for morphine over the phone? Well, the answer is yes, but, and this is a huge but, it comes with some very strict conditions. It can only be for the smallest amount needed to get through the emergency. The prescriber absolutely must follow up with a hard copy prescription within 7 days. And here's the key part for you. The pharmacist has to personally verify that the prescriber is legit before dispensing anything. Okay, let's do a final rapid review. Think of this as your mental flashcard before the test. CIIs? No refills, no transfers, separate file. C3s and 4s? 5 refills in 6 months, 1 transfer. Every controlled script needs full patient and prescriber info, including that all-important DEA number. And you've got to keep all records for 2 years. Got it? Remember, these rules aren't just for an exam. They protect patients every single day. So as you prepare, think about the real world. Which one of these rules do you think is the easiest to miss in the rush of a busy pharmacy? Thinking about that will really help you understand why every little detail matters. All right, that's it for our deep dive on controlled substances. Study smart, and I'll see you in the next one.